Once bile is produced by the liver, bile through the bile ducts income to the gallbladder. And gallbladder is the place where bile is stored until we consume some fatty food. Basically, the only function of the gallbladder is to store bile and to reabsorb water from the bile during the storage. So gallbladder makes bile more viscous, and increase in viscosity creates some problems. Let's take for example cholesterol stones. So for example, we have a female patient with obesity that has a lot of children and also she is older than 40. So all these factors increase the amount of cholesterol in the blood and thereby the amount of cholesterol in the bile. And now such bile with very high amount of cholesterol income to the gallbladder. And after water reabsorption, the concentration of cholesterol becomes extremely high. Such state we call hypersaturation with cholesterol. And in this state, gallstones are formed very rapidly. So with time, finally, this causes formation of a cholesterol gallstone. And the presence of gallstone in the gallbladder we call cholelithiasis. And such stones inside the gallbladder remain totally asymptomatic. But after intake of the fatty meal, at some point, large amount of fatty acids income to the duodenum. In response to dietary lipids, eye cells of the duodenum secrete cholecystokinin. Cholecystokinin is a specific hormone that stimulates contractility of the gallbladder. So as a result, gallbladder contracts. And by this, gallbladder pushes bile together with cholesterol stone into the cystic duct. Recall that bile flow from the gallbladder into the common bile duct is equal to pressure inside the gallbladder minus pressure inside the common bile duct divided on resistance between them. So with contraction of the gallbladder, the pressure inside the gallbladder increase and as a result flow increase. So by contraction, gallbladder pushes bile through the cystic duct into the common bile duct. In ideal scenario, such gallstone freely pass through the cystic duct, then stone pass common bile duct and enters into the duodenum. And from the duodenum, such stone is excreted with the feces. But sometimes, such stone cannot squeeze through the cystic duct. In this case, stone causes an obturation of the cystic duct, and with obturation of the cystic duct, radius of the cystic duct decrease, with decrease in radius, resistance increase, and with increase in resistance, flow decrease. Basically, with full obturation, there will be no flow of bile through the cystic duct. As we see, the major provoking factor that leads to obturation in the biliary tract is intake of fatty meal, because it's fatty meal induced contraction of the gallbladder that pushes stone into the biliary ducts. With the stone in the cystic duct, there is two possible scenarios. The first possibility is that this stone will be so large that it will cause prolonged obturation of the cystic duct. With prolonged obstruction, usually inside the gallbladder, bacterial infections develop. And infection causes inflammation of the gallbladder walls. This condition we call cholecystitis. Initially, acute cholecystitis develops, and multiple episodes of acute cholecystitis lead to a chronic cholecystitis. So, if stone remains inside the cystic duct for a prolonged period of time, inflammation of the gallbladder develops, and exactly itis in cholecystitis means inflammation. The second possibility is that this stone will finally squeeze through the cystic duct into the choledocus, and such temporary obstruction that resolves by itself after 20 to 30 minutes we call biliary colic. Once stone passes the cystic duct, the same stone can cause obstruction of the common bile duct. Usually, such obstruction occurs in the region of the sphincter of Oddi because it's the most narrow location. And if stone causes obstruction of the common bile duct, we call this condition Choledocholithiasis. If stone causes prolonged obstruction of the choledocus, choledocholithiasis can be complicated by bacterial infection. Bacterial infection can cause inflammation of the biliary ducts, a condition known as ascending cholangitis. So cholangitis is inflammation of the common biliary duct walls. But the better scenario is that the stone can pass through the choledocus into the duodenum and such stone will be simply excreted with the feces.